I want to talk about your practice. It's such a special practice. Not only new age women's health, but there's also new age medical research because, as you mentioned, you stopped delivering babies in 2001 and sort of focused on clinical trials. So talk to me about the both.
Well, I actually, at the time I stopped obstetrics, at that time is the time that we started the research business. I started the research business and have grown it into a really top-notch clinical trial site, a private clinical trial site in the United States. We really enjoy a very top-notch A+ reputation in women's health trials for contraception, menopause, anything related to gynecologic issues.
You're currently working on a trial right now for CMV, is that correct?
That is correct.
If you can share that with our viewers at home of what that is and what are we seeing from these trials and what CMV is.
CMV is cytomegalovirus. It sounds really awesome, but it's not. It's a very common virus that causes a cold or really no symptoms with most patients, and probably 4 out of 5 people, adults walking around, are immune to it. They've had it, they develop immunity, and they're not susceptible to really getting it again. But if you're in that group of 1 out of 5 people approximately, and you've never had it, and you do get it when you're pregnant, about 15% of those babies born have a congenital anomaly, hearing loss, some neurologic problems, and is actually the problems from that are more common than Down syndrome. And so Merck is a large company that's big on vaccines, and they have come out with a vaccine for CMV, and we are in the later stages of clinical trials to promote that. And it's a great thing because women who join the trials who are vulnerable to getting it can avail themselves of this vaccine that is still going to take several more years to come to the market. So we're looking for patients who are willing to do it. It's very safe, very effective, and very needed.